Thank you for inviting me today. I'm from the Patients Association, and I'm going to tell you a little bit about the work we do, how we actually gather and use patient feedback. I'm going to talk about primary and secondary care. I noticed on the programme it said friends and family testing in primary care, but I'm widening it out to that. And then if we've got time, I've got a short film clip at the end, which just brings us back to what patients are actually saying. So I hope you all know about the Patient Association. I've entitled the talk, Listen, Hear and a Human Touch, because that's the message that we're getting loud and clear with a lot of the work that we're doing at the moment. And it's very much about, yes, okay, you're listening, but what about, hearing what I'm saying and having that human touch? The Patients Association is a long-established independent charity. We've been going 51 years now, and actually it was started by a patient. And we have quite a high media profile, so hopefully you've heard about us. So we're non-disease specific. We cover any patients, carers across the country. And we do a lot of campaigning on patients and carers issues, often through themes and issues that are raised at our national helpline. So anybody can contact our helpline, and we actually get a lot of staff contacting as well as patients and carers. We've been expanding more recently to work more locally with NHS trusts, CCGs, GP practices, area teams, that sort of thing, and on projects specifically to impact upon patient experience. And we make use of patient stories, feedback and reports. And every year we produce a patient story book, and they are the worst stories from the helpline. But we're quite pleased that a lot of the universities and colleges tell us that they use those stories for case studies for new students. So the next one will be issued fairly soon. So sort of busy diagram, but it just tells you a little bit about the different aspects of our work. So we have our helpline, as I say, where we use some of the feedback for CQC. We actually give them some of the the stories that we have. We monitor the trends, as I say, and we actually provide a casework support service. And we're finding that we're increasingly being asked to do that with some very complex cases that often, perhaps with some support earlier on, with an independent mediator, might not have got to that stage. So that is something that we do offer. We also have our policy and campaigns aspects, and our current campaigns around the care campaign, which you've probably heard about. That's been going for about 2 years now, and that was very much around the basics of dignity and care. And we produce regular reports, so we've just done something around the NHS Constitution. And then the bigger bit at the bottom is our expanding work with NHS trusts and CCGs, and more recently we've been working with a number of GP practices in the southwest on developing patient participation groups, and that links really well with the friends and family tests. In fact, I met the project manager the other day, and we're saying actually the work we're doing really dovetails nicely. So I'll talk a bit about that as well. So the key aspects of our work, as well as patient experience, that blue box, we do a lot of independent gathering of feedback, and we do find that patients actually do like to have an independent person to feedback, because human nature, people are a bit wary of giving feedback direct to trusts and staff. So the patient experience aspect is around that. Information is a big aspect too, providing people with good information, and particularly around the NHS Constitution now, around people's rights, but also their responsibilities in terms of looking after their own health. Then the patient involvement side is very much about the whole emphasis on shared decision making, self-care, being involved in the sort of co-production side. And then the improving complaints processes. Following a large project that we had in mid-staffs about 2 years ago, we've developed some standards for good practice handling, and we do a lot of training and peer reviews and that sort of thing. With all the work that we do, we keep emphasising, and I know that a lot of the government documents and everything that comes out talks about patients being at the centre, but that is so important. But we know the NHS is under considerable strain, and it really can't carry on as we are. So those increasing demands, constant reorganisations, things like the duty of candour, better regulation is all very welcome, but actually unless it's implemented properly, it's not going to make any difference for patients. And we're still getting frustrated callers, calling our helpline in despair, and some of the things that we're hearing, you think, surely that still isn't happening. Particularly around actually GP, people being struck off GP lists when they try and complain, which I didn't think would happen anymore, but that still is happening. There's also a gap between the commitments in the NHS Constitution and the reality of being a patient. And a lot of people have never heard of the Constitution, and nor have staff either. So I think there's a lot of work to be done around that as well. So there's never been more of a time and more of a need to gather patient feedback and make use of it. And we're conscious that there are lots of information being gathered, and we've heard about the friends and family test, but actually it's making use of it to actually see those improvements. So the projects that we've been doing to influence change, as I say, it's very much about having that local presence and proactively working together to find solutions. We've built a relationship with a number of NHS trusts, but that independence really does seem to make a difference. And through the projects, we've been developing a whole range of different tools, methods, topics, ways to gather patient feedback and influence and involve. Co-production and shared decision-making, as I've said, is a key aspect of that. And you can't really separate the patient involvement from the patient experience because it all sort of links together. Plus the learning from complaints. That's a whole new aspect of data that should be fed into your patient experience feedback. And listening to people's stories, because there's no better way to hear about people's experiences than through stories. That's a very busy slide. I'm not going to read it all out, but just gives you a flavour of the projects that we're doing at the moment. We've got about 90 projects that we've been running since over the last 2 or 3 years. And they're all really basic things that have come about from what patients have been telling us. So things like improving people's experience of dementia care, information, meeting patients' needs at meal times, customer care, complaints improvement, review of lost property, discharge to care homes, so all the things that you're dealing with on a day-to-day basis. But we actually mapped them against the Francis Report recommendations. And what I failed to mention earlier was that Sir Robert Francis is now our president, and it's nice that he describes us as the only show in town, which is quite a compliment. But he's made a big impact on the work that we've done. I talked a little bit about co-production. I hate the word, but it's just emphasising this difference between patient involvement, asking people feedback, but actually changing that relationship to seeing patients as equals and working together. And it's all or nothing. It's not a tick box that we've done our survey or we've got a patient group or a forum. It's actually really meaning that and seeing it through all the work that you do. So working together as equals, as colleagues, as joint experts, and recognising what a role patients and carers can have to actually help you in your improvements. And by listening and working together, we've seen some real improvements and some great work. So how do you do that? It's easy to say it, but how do you do it in practice? Actually ask patients and carers for their ideas, not just their feedback. But also use different types of feedback. So don't just rely on the friends and family test or your survey, but use a whole different range of different things and bring them all together with that feedback. So it's the qualitative bit as well as the quantitative. I know lots of this is happening already, but making use of volunteers, governors, doing walkarounds, involve students. We've had some great projects with students and then there's a two-way process there because students are actually learning good practice early on and actually having a chance to listen to patients. We did some good work with some medical students who wouldn't have had the opportunity to talk to patients at that early stage, and some of their testimonials was really insightful. Use your social media, e-surveys, Twitter, Facebook. These are things that we need to make better use of. And I know people are a bit wary of them, so it's having a good knowledge of how to use them well. We've been also been doing something called community reporting, where we train volunteers up in the use of little flip cameras, and actually people have gone out into their local communities and got stories, and that's the film that I'm going to show you shortly. And that's had a great impact in actually hearing from people that we wouldn't normally have heard from. We did a project up in the north with different people from different ethnic groups, from a homelessness hostel, and some of the stories there actually we wouldn't have heard from otherwise. So reach out to people, don't expect them to come to you. And I think particularly with the primary care now and the patient participation groups, the projects that we're doing in terms of setting those up, you've got to go out to people. You can't expect people to come to public meetings or and be interested, really, because people have got busy lives, and it's not that important for people to to go to meetings and things. And involve patients and carers in projects and setup, delivery, recruitment, staff training. We're doing some really interesting stuff at the moment where actually if people have complained, you can work with those people and really get them involved in some of the changes. Most people don't want to complain, and actually they want to see that it doesn't happen to anybody else. So that's a great way to involve people. The biggest thing, I think, is make it easy and be welcoming, because I think so often people feel that they're a bit wary of feeding back and they don't feel welcome. And I think what I've been struck with is that a lot of staff are afraid of actually talking to patients. And I went to a meeting recently where there was quite a complex complaint, and we got the staff together and the patient, and it was 3 years on. It was a family whose child had died. And 3 years on, they actually got together, and that was the first time they'd met. And it was all about sort of assumptions and misunderstandings, and actually, it's so important to get that face-to-face and actually talk to patients. So thinking about sort of creative ways to gather feedback. Use film, audio, surveys, observations, complaints, as I've said. Our complaints work, we've developed a peer review process where we look at a number of complaints files, and it's a mixture. We have teams of clinicians, lay experts from a particular trust or a CCG looking at the complaints files. And some of the feedback we're getting from that is what a useful learning experience that is. CQC, we were involved recently with the new inspections, and actually the fact that patients are a part of those inspections. We were looking specifically at complaints. The CQC inspections in primary care, I know the recent ones have actually been asking to see the members of the patient participation groups, and again, great opportunity there. Observation, we've done a lot of work with the quiz tool, the quality of interaction schedule, which some of you have heard of, or the sit and see tools. These are tools readily available and really useful just to sit and watch and observe and then feed back to teams on that with that immediacy. Mystery shopper, that's been successful, where we've invited people to be a mystery shopper, mystery patient when they go into hospital or receiving their community services. Perhaps at pre-assessment you can talk to people about that and get them involved. And then either they keep a diary or they will feed back. Often they like to feed back to us again as an independent organisation, but then we can produce a report with findings for a trust or a CCG. Questionnaires, always try and involve patients and carers in the design of those, because so often the questions actually are misinterpreted. And it's interesting, again, that the friends and family test, I was talking to a group of people the other day, very bright, able chap was saying, well, what's this friends and family test? Is it asking friends and families about, and then it was explained what it was, and he said, well, how ridiculous. He said, I'm not going to recommend my hospital because my son lives in Maidenhead. So it's, again, it's understanding how people interpret some of the questions, and they might need help with that if you're starting to fill those in. Mini case reviews, again, we've looked at sort of 1 or 2 case files around the complaints work. And actually we've held some focus groups of people who've complained, and actually people who complain don't like to be called complainants. So that's been an interesting exercise. Involving staff, involving patients and carers in staff training, that can be really powerful too. So feeding back their experiences directly to staff as they're trained. Our helpline and case support, as I've talked about, and the PPGs and friends and family. arts and health and storytelling. I'm just going on to the next slide. Actually, we've done some really interesting stuff around arts and health, and most areas do have arts and health organisations linking up local artists. And that's a great way to get feedback, to get message across. We did some work in GP surgeries around, it was sort of a makeover and getting local people involved in some artwork. We got the youth service, young offenders, older people, and just the benefits of that. And you can, again, communicate, gather feedback using art in a much more creative way. Patient participation groups, I mentioned this in primary care, a big move now to develop those, and we've got a project in the southwest. We're working with 233 GP practices at the moment. And a lot of practices that the PPGs have perhaps been going a long time, or they just can't get them off the ground. And we're trying to look at new ways of developing those, trying to break down those barriers, build understanding about what the role of the patient participation group is, and really seeing what the potential is. Can help with the friends and family test. Actually, if you link that together, your patient participation group could be helping administer the friends and family test, talking to people in the surgeries about it, but also analysing the results. The CQC registration inspection I've mentioned, but also things like health promotion and information. Actually, your patients are your biggest advocates, and they can be actually giving that information, running information fairs, flu clinics, all those sort of things. A great potential there. And education, educating other people about, how to use the NHS appropriately. When do you go to the walk-in centre, or when do you use A&E? Make use of your patients much more in getting feedback around that. So you see patients as a valuable resource to support your practice, from public health campaigns to fundraising. But this also applies to acute trust too. We've done a lot of work recently in setting up patient councils and forums, and again, great way to do that. This is a GP from Weston-super-Mare who's really into actually going out to people, and this is a book that's called The Great Good Place, and it's about going to people in different communities, and that's where you're going to get your patient feedback. So working with the Patients Association, lots of benefits and outcomes that we've been told makes a difference in actually working with patients, finding solutions together, sharing ideas, best practice. One of the things we emphasise too is, there is a lot of good practice and we do want to share that. So it's not just about the sort of the negative stories. But the idea of getting change quickly implemented and influenced by patients and carers. But also bringing that independence and professionalism, which I think a lot of people are frightened won't happen if you're working with patients, which isn't the case. Innovative, responsive, and benefits on all sides for commissioners, providers as well. But learning from experiences, doing something about it and showing the results. I won't go into details about the NHS Constitution because we're running out of time, but we've talked a little bit about that. But just to say, the key themes to our helpline at the moment are around GP services, registering appointments, communication, the quality of care in hospital, all things that you're aware of. End-of-life care seems to be coming up a lot at the moment, and complaints. Other helpline themes, there's been real concerns about care, informing and communicating. Communicating always comes up, doesn't it? The right of access to services and people knowing how to access services, and the transfer between services. Obviously, that's still an issue. Integration doesn't seem to be happening still. Treating people with dignity. You would think this, we wouldn't need to be talking about this in this day and age, but it's still coming up time and time again. Is it because people are so busy? Is it because staff are desensitised? I don't know. But some of the stories we hear still are just shocking. Involvement in decisions. Actually, people not being told, if they're what's happening, not being involved, carers, families not being communicated with. Access to records, people still not being given copies of things, and not knowing how to make a complaint. Got a couple of patient stories here. Lucy told us she wasn't happy with her doctor's surgery. She went to see a nurse who was quite rough with her when she was taking a blood sample. And while she was there, another nurse walked into the room while she was half dressed. Lucy felt vulnerable and she wrote to the practice manager about her concerns and was told, well, you can leave. Is that really responding to patient feedback? And we hear that a lot. Another one, somebody's medication had suddenly changed. The GP didn't tell them about it. So when she got home, she opened her prescription, was panicked. This isn't my normal medication. So couldn't go to the pharmacist until the next day. Went along, the pharmacist explained that this was a change, why the doctor had to change the medicine. But when you think about that, was patient feedback, wasn't it? But actually, did that pharmacist feed back to the GP that this was happening and this was actually, it would be helpful if the GP had explained that in the first place. So it's using patient feedback in different ways. Complaint or concern. So often we hear things have gone to really complex complaints and they could have been prevented if there'd been that communication early on. And one of our top standards, we've got 12 standards of good complaints handling. The first one is around actually having that face-to-face meeting, and still that isn't happening. Make people, be encouraging to people to give feedback. Most people, they don't know who they should speak to or how to give her the concern. There's no leaflets, there's no posters. So people feel forced to make a formal complaint as the only way forward. And that's coming up on our helpline, our helpline report this time. It's still happening. So what do patients want? Patients still are not being listened to. Our staff hearing what is being said, even when it appears they're being listened to, it might be a wrong message. And so often with the complaints, actually when you read the complaints letters, they've missed the point. It's totally, the message that what the person was complaining about wasn't actually what was responded to in the letter. So patients want to be treated as human beings, and we're all patients and we all want to be treated as human beings, and just imagine if you were in that position. So we want genuine care and good communication and getting things right the first time. People who use services are the best people to know that. We know what works best, what doesn't. So it's not just about patient satisfaction, it's about all those other aspects as I've talked about. Involve patients in the planning, the development, monitoring at all levels and at all stages within your governance structure. And develop that mutual respect of equals. Using our knowledge and experience of services and working alongside professionals to get it right first time. It doesn't always happen, but if it doesn't, then put it right quickly. Put those systems in place to stop things escalating. So in summary, listen to me, hear me, treat me as an equal, see me as a person, and make it easy to give feedback in whatever way it's best for me. Find ways to work together to learn and improve, and review the feedback, interpret and implement the change together. I can say any questions, but can I just show you the film? And then maybe we've got... Okay, hopefully that gave you a bit of a flavour of different ways to gather feedback. And I think the other thing about that film is that it didn't need to cost a lot of money. It's not a slick, well edited, well filmed, something by a professional, but actually how powerful that is. I don't know if you've got any questions, but hopefully that was helpful.
Can I ask how you identify the projects in which you're going to become involved? Because you had a lot on your screen earlier, and it'd just be nice to know how you actually identified those.
Yeah. What we normally do is we talk to the trust. Either trust will approach us, or a CCG, or an area team, or whoever. Either they've got an idea, or they want to work with us, but they don't know what they want to do. So we'll explore, what are the key issues, perhaps from the survey. I mean, one recently was around call bells, and that trust knew that they hadn't performed very well in the national survey on call bells, but wanted to understand better why. So we did some more detailed work. We trained up some volunteers in that trust. They worked, we did a more detailed survey, but we also did interviews, and we filmed some patients, and then we ran a staff training workshop. So that's, with all the projects that we do, we always produce a report with recommendations and jointly agree that with the trust or whoever, and then come up with an action plan for improvement. So we don't want it just to be about feedback, it's very much about influencing the improvements.
Any more questions, anyone?
Okay. No.
Thank you very
Thank you.
much.